Drivers of the centralized ambulance trauma services in Delhi who are currently on a strike. And what this means is around 1,000 ambulances in the national capital are off the roads, are off bounds for the patients, as drivers now demand that their dues should be immediately cleared. Drivers claim that they have not been paid salaries for the past 3 months. The contract of the ambulance service is given to a private company and the issue is now stuck in technicalities. Meanwhile, due to this strike, healthcare services in Delhi have taken a hit and many patients affected as emergency ambulance services are not available. Alok Singh joining us live with more inputs on this. So Alok, I believe you spoke to the CATS union president as well and several others. Give us a sense of what this is about. I mean, why is an emergency health service like ambulance not functioning in the national capital of our country?
Well, see, Afrida, that this ambulance services is the lifeline of the Delhi, basically, and this CAT ambulance service, this central ambulance trauma service that is started in 1992, and with the 31 ambulances in their feet. But earlier it was under the Delhi government. But in the 2012, during the time of expansion, it was given to the hands of the private sector, and the private company started doing the operational work of the CAT ambulances. So the people who were joined as a driver, as the paramedic staff of the CAT ambulances, the number of their reached to the 1,400, and presently that these are the 1,400 employees who are working as the drivers and the paramedic staff who work on the ambulances daily basis. Let me tell you, the number of ambulances are 265, and due to this strike, that all 265 ambulances are off the roads. So and these ambulances, the responsibility of these services are just to take the emergency patients from the emergency to the hospital, to the care services, and because of that they are all now suffering because that is all done with the free of cost. So the people who are basically from the poor strata, they are basically suffering from the strike of this CAT ambulances services. Let me tell you right now that they are doing the protest here because they are saying that they are not getting salary for at least 3 months because of the privatization. The private sector, the company who are hired them, they are harassing them. They are basically cutting the charges of that is what we call at the maintenance charges from their salaries. So they are not giving that. That is their concern. That they are also saying that why they are under the private sector, and they want there should be no third party, and they directly want to come under the Delhi government. So this is the basically concern. Right now they have just conducted a mock procession of the government and saying that because the government is not listening to them, so they conducted a mock funeral procession. I am here with some of the drivers. Sir, आप लोग बताएं, आप लोगों को क्या दिक्कतों का सामना करना पड़ रहा है आप लोग के परिवार?
अब 3 महीने हो गए, पैसा नहीं है घर में, बच्चे के स्कूल की फीस को पैसा नहीं है, खाने को पैसा नहीं है, यहाँ भी हम पैदल आते हैं, हमारे पास किराए के भी पैसा नहीं है, और प्रशासन नहीं सुनना, ठेकेदार कहता मेरे पास कोई पैसा नहीं है, तो कहाँ जाए साहब?
This is the basic concern that they are saying. The private company which has hired them, they are saying they don't have the money. When we try to talk to the government officials, they are saying they want to try to sort out the issue. But the question here is, Afrida, that why the government is not paying to them. They can also pay the basic the left amount, that the 3 months of salary to these drivers. But the government seems to be reluctant, that they are not listening to them. That is why that they are doing the protest. And today it is the 4th day. But nobody is coming. Let me talk to one of भाई साहब, आप बताएं कि क्या आप करते हैं और कितने साल से आप इस सर्विस में जुड़े हुए हैं?
मैं कैट्स एम्बुलेंस पायलट हूँ, 3 साल हो गए मेरे को, और 3 साल से शोषण करती हो यार ये कंपनी है, और अब 3 महीने का हमारा वेतन नहीं दिया है।
3 महीने का वेतन?
3 महीने का वेतन।
प्राइवेट के लिए प्राइवेटाइजेशन आप लोग चाहते हैं ना हो, और ताकि आप लोग गवर्नमेंट के अंडर में, ये क्यों चाहते हैं?
नहीं, गवर्नमेंट हमें सैलरी टाइम से देगी, और ये प्राइवेट बिल्कुल खत्म कर दिया जाए, शोषण बिल्कुल खत्म कर दिया जाए।
बताएं आप क्या बोलना चाहते थे कि अभी आप लोग की क्या डिमांड है? एज अ प्रेसिडेंट आप हैं, आप क्या चाहेंगे? अब आप आगे क्या करेंगे?
देखिए, अभी आगे के लिए तो ये है कि जिस प्रकार से सरकार ने ये कर्मचारी विरोधी कदम उठाए हैं। एस्मा का डर दिखाया, एस्मा लगाया है और कह रहे हैं गिरफ्तारियां करेंगे। हम ये कर्मचारी 3 महीने से वेतन नहीं मिल रहा है, इनके घर परिवार के चूल्हे नहीं जल रहे हैं। और दूसरी तरफ ये कैट्स प्रशासन के अधिकारी, जैसा कि भी आपने कहा कि मतलब सरकार को पे करना चाहिए सीधा से, ये वास्तविकता यही है कि सरकार अगर सीधा पे करेगी तो करप्शन नहीं होगा, अधिकारी की जेबें गर्म नहीं होंगी, ठेकेदार उनको उनका कमीशन नहीं दे पाएंगे। अब ठेकेदारी आने से क्या होता है कि कर्मचारियों का मेहनताना काटा जाता है और वो अधिकारियों से लेकर और ठेकेदार की जेब में जाता है, शोषण होता है कर्मचारी का। इसीलिए हम मांग कर रहे हैं कि ये पिछले 3 साल से बहुत बुरा शोषण हुआ है यहाँ पर।
Alok, just hold that thought. I have Dr. Sanjeev Bagai, Chairman of the Nephron Clinics, joining us now on the broadcast. Good morning, Dr. Bagai. Your views on what you see happening here. This is an emergency health service that we are talking about. It has been left to the whims and fancies of private contractors.
Hi, good morning. I think the largest section of the Delhi population relies on this integrated ambulance emergency pickup service. I think it's criminal not to have it functioning on the roads. I think the Delhi government should step in immediately and give an interim grant of at least a month's salary or whatever they feel is justified, so that the poor people who are also the drivers are not actually in a compromised situation.
Yes.
They may do the internal audit and see what and where the faults are, but at the present moment the services should not be stopped.
Yes.
If a poor man is unable to support his family, how is he going to come for work? But having said that, the full issue of the contractors and the ठेकेदार्स and X percentage as commission being taken, I think all this kind of things is passé. This should never happen, not at the present age and time, and not in the national capital. I think it should be a streamlined service. It should be a seamless integration service. We have good technology. We can integrate them through GPRS. The Delhi public and the common person relies on this service. And when we keep talking medically of the golden hour, the first 45 to 60 minutes when a patient has either a stroke, unfortunately, or a chest pain for a cardiac event, if they don't get an immediate service to go to the closest hospital for the casualty or the emergency service, precious lives can be lost. So I think my request really is that the Delhi government should step in. It should pay an interim grant as an ad hoc payment, and they can keep settling the internal accounts later. That's an internal administrative issue. But the services should not be stopped.
Absolutely.
And the poor people who are also the drivers should not be at a compromised position. What are they going to do? How are they going to eat? And what are the poor people going to do when they don't have this kind of service?
Right. Dr. Bagai, you have just summed it up very accurately for us, because you've highlighted both the issues. The fact is that on one hand, you have these drivers, the workers who are completely feeling harassed because of their dues not being paid. On the other hand, a very critical healthcare service, the immediate medical care cannot be deprived to critical patients. Precious lives could be lost there. Thank you, Dr. Bagai, for joining us. So, Alok, that's the view coming from doctors, that this is a service which cannot be terminated, not even for an hour. And we have a suspension of ambulance service in Delhi that would directly impact, critically ill patients.
Well, yes, that in fact that if you talk about the statistics, that around 1200 calls they daily attend. So these 1200 calls, that all 1200 people that who usually basically the patients that who call to this, who are dependent, as the doctor also said, that the large section of the Delhi are basically dependent on these ambulances services. And if they are on this strike, they will definitely gonna affect with that. And yes, that as I am telling you, that 1200 calls that daily attended by these CAT ambulances, and because of this service stalled, these calls are not being attended. And in fact, if you call to the 102, this is the helpline number for the CAT ambulances.
Yes.
There are the people who are sitting on the control room. They are directly saying that there is a strike. They cannot do anything. You can just hire a private ambulance to take your patient to the hospital. So this is the reaction coming from the control room. So there is the huge problem, that is the people who are basically, that the huge section of the Delhi is dependent and they are basically affected by this strike.
The ambulance services must be immediately restored. It is the responsibility of the Delhi government to intervene. There can be ad hoc payment being made to these workers so that they get back to work. It simply wouldn't do to shirk off responsibility to the private sector. Thanks very much, Alok, for giving us the ground reality.